So in this study, we prospectively evaluated the clinical validity of a novel metastasis biomarker called TMEM. TMEM stands for Tumor Microenvironment of Metastasis, and it is an assay that is based on a triple immunostain that identifies motile intravasation competent tumor cells identified with an antibody called pan-MENA, endothelial cells, and macrophages that are in direct contact. Previous work in the laboratory, basic science work, has shown that TMEM are microanatomic structures where tumor cells actually intravasate into the circulation. This is based on a publication that was in Cancer Discovery in 2015. And there are agents that one can actually use to block the function of TMEM and prevent metastasis. So in this study, what we did was used an analytically validated automated assay to identify and enumerate TMEM structures in a clinical trial cohort called E2197. The study involved a subpopulation of this cohort, about 600 patients who had early stage breast cancer with 0 to 3 positive nodes. They all received adjuvant chemotherapy, including doxorubicin and cyclophosphamide, or doxorubicin and docetaxel. And the outcomes were similar between the two treatment arms. And if patients had estrogen receptor positive disease, they also received at least a 5-year course of standard endocrine therapy. What we found was that the TMEM score was significantly associated with distant recurrence in this population of patients who had 0 to 3 positive axillary lymph nodes, early stage breast cancer, specifically for early recurrence. In addition, TMEM score provided prognostic information that was independent of tumor size, nodal status, and grade, and also provided information in multivariate models that was independent of recurrence score. And finally, the TMEM score provided prognostic information in patients who had a low recurrence score defined as less than 18, or a mid-range recurrence score defined as 11 to 25 as used in the TAILOR-X trial. So for example, for a recurrence score of less than 18, if one looked at the hazard ratio for recurrence in those who had very high versus low TMEM scores, there was a 10-fold higher risk for distant recurrence for high versus low, and 5-fold for mid-range versus low. And similar findings were observed for patients who had a recurrence score of 11 to 25. There, the hazard ratios were in the range of four-fold higher risk of recurrence for higher TMEM score, and 2-fold higher risk for a mid-range TMEM score. To summarize, this is a new biomarker. It's a metastasis biomarker that does not correlate with the information that's captured by gene expression assays that generally reflect proliferation and ER signaling. And it provides prognostic information that's complementary to recurrence score in patients with ER-positive, HER2-negative breast cancer.